Hello, Professor and class. This is my SOAP note case presentation for FNP 597. The patient who I am doing mine on, his initials are JD. It's a Caucasian male. He is 45 years old, birth date of February 18th of 1980. Subjective, his chief complaint was he's had lower back pain for the last week. His HPI is that JD is a 45-year-old Caucasian male who came into the clinic with a complaint of lower back pain that began about a week ago. The pain developed without any identifiable injury. It's localized to the lumbar region, does not radiate, and is described as a constant dull ache rated 5 out of 10, with the worst of the severity being 7 out of 10 while he's been standing for long periods of time or with prolonged sitting. The pain is alleviated by lying down, taking ibuprofen, and that seems to provide a partial relief of pain for him. He denies any numbness, tingling, weakness, in the lower extremities. There's no bowel or bladder dysfunction, no fever or unexplained weight loss. His medical history is just hypertension, which was diagnosed about 5 years ago, which is managed with medication, and anxiety, for which he just uses behavioral therapy and currently is not on any medications for that. His only previous surgeries are an appendectomy at the age of 25, and there were no complications with that. Upon physical examination, his general survey, he appeared well-nourished, well-groomed, in no acute distress. He actually had a cheerful affect and appeared to be his stated age. Musculoskeletal assessment, he had tenderness over the lumbar spine and paraspinal muscles. Normal range of motion with mild discomfort, no erythema, warmth, or swelling. So this is quite a typical lower back pain that we see in the clinic on a regular basis. Neurologically, there were normal deep tendon reflexes, and he had negative straight leg raises bilaterally. My differential diagnoses for this patient was first lumbar strain, which is the most common cause of back pain, especially with no neurological symptoms. Lumbar disc herniation would have been my second one, considered due to this patient's prolonged amount of sitting. He does work in an office. Less likely, as there's no radicular symptoms present at all. Degenerative disc disease is also could be a differential diagnosis, but then I would expect more chronic progressive pain more than just a onset of a week. So the final diagnosis I came up with was lumbar strain. The plan, technically there are no diagnostics needed at this point. However, if the symptoms were to persist beyond 4 to 6 weeks, or if he had neurological deficits, then that's when imaging would be more likely required. As in terms of the treatment for this patient, he currently is taking 200 milligrams of ibuprofen at home. I would have him increase that to 600 milligrams orally every 6 to 8 hours as needed for pain. I would go ahead and prescribe cyclobenzaprine, 5 milligrams PO at bedtime for a week if the muscle spasm is present. So if it gets worse at night, I would tell him to take it then. I would also let them know that heat therapy for about 15 to 20 minutes 3 times a day could greatly increase blood flow to the area and will also help with the pain and inflammation. And of course, encouraging physical activity by encouraging stretching, walking, and avoiding the prolonged sitting. So if there's any way he can get up and stand next to his desk for a while he's dealing with this, those are all great ideas for him. I would educate him about proper body mechanics, ergonomics, and posture improvement. most people don't have great posture anymore nowadays, so I think that that can have a lot to do with it as well as educating him on the importance of exercise and weight management. According to his BMI, which I did not share with you, he is overweight, but he is not obese. So I would encourage, exercise, weight management. Those all help in back pain prevention. Signs and symptoms warning urgent reevaluation would be numbness, weakness, bowel, or bladder dysfunction. And if he were to have any of those, most definitely he needs to immediately follow up in the emergency department if any of those neurological symptoms arise. Otherwise, I would just have him follow up in 1 to 2 weeks if there was no improvement or if there were worsening symptoms. At that point in time, then we would go ahead and discuss more diagnostic tests and most likely refer to physical therapy. Thanks for listening to my explanation, and I hope you guys enjoyed it.